This is Kathy Knipfer, instructor for Nursing 2313, recording the community-based nursing lecture for Chapter 13, entitled Specialized Home Health Care Nursing. Disease management in the home, by definition, is a system of coordinated healthcare interventions and communications for populations with conditions in which patient self-care efforts are significant. This disease management encompasses providers across the healthcare continuum. The goal is to improve clinical outcomes and lower overall costs. Outcome data are the fundamental element for success. Disease management in the home focuses on chronic conditions that are difficult to manage and costly to treat. Examples would be congestive heart failure, asthma, coronary disease, diabetes, osteoporosis, stroke, and chronic wounds. The role of the nurse is to promote self-care skills through case finding, use of evidence-based practice or EBP, collaboration and consultation, support and counseling, health education, and the use of nursing process. Trends in disease management in the home include using technology, the use of rigorous evaluation research to establish efficacy of programs or models. Trends include quality monitoring and collaboration with a multidisciplinary team. Telehome care, or telehealth in home care, is an interactive two-way process that allows contact with homebound clients to monitor clinical progress. It is accomplished wholly or partially with electronic means. The main advantage is cost savings. Many health plans, including Medicare, now cover telehome care visits. There are some disadvantages of telehome care. It's difficult to practice relationship-based care via telecommunication. It also creates ethical challenges. We should remember that high tech should not replace high touch in the provision of nursing care. When we describe the role of the nurse with telehome care, we think of 3 M's: monitoring, managing, and motivating. The trends for telehome care include an increasing use with a wide application. Another trend is its use for disease management, the trend of it being more affordable. There's more research and evaluation of telehome care use. And also the legal and ethical issues are being considered. Home infusion therapy includes chemotherapy, pain management, fluid replacement therapy, immunosuppressive drug therapy, inotropic therapy, and blood and platelet transfusion. It is widely used as a cost containment strategy, but the reimbursement criteria are strict. Pre-authorization is essential prior to initiating infusion therapy in the home. There is an increased expectation for families to administer medications and fluids through central lines. The nurse who works in infusion therapy should have sharp problem-solving and interpersonal skills. The nurse should also have detailed knowledge of therapies and their effects, as well as technical skill in working with equipment. This nurse provides direct caregiving or delegated medical function. There are safety requirements for infusion therapy in the home, such as an emergency plan, having a functional phone, a list of emergency numbers, even having a 3-pronged grounded outlet, and availability of a refrigeration. Notification of authorities about a person on life support or medically necessary infusion or oxygen. It would also be important to have information on medications, environmental hazards, and as well as patient-specific concerns. This nurse also performs assessment, provides education, obtains pre-approval, and of course Documentation. Patient safety is a major issue in infusion therapy. Nurses who work in infusion therapy must possess a sophisticated skill set. There's a trend for certification to be required to be employed as an infusion nurse. This might even be tied to reimbursement. There is some data that indicate that certified nurses experience fewer adverse events and errors when compared to non-certified counterparts. Competencies should include venipuncture and the assessment skills of the nurses related to the therapy and, of course, the vascular access devices. Now let's talk about wound care. Wound care is not simply a technique of dressing application. It involves a discipline of specialized practice for wound care that includes advanced training, education, and certification. Wound classifications include acute, which occurs at the onset of the injury. It becomes chronic when the wound healing process goes beyond the expected trajectory. The role of the nurse in wound care includes ongoing evaluation of wounds and risk factors for healing. It also includes preparation prior to the first visit. What does the nurse need to know? The main functions with wound care are delegated medical functions, consultation, counseling, collaboration, and health education. Mobility enhancement and pain assessment should be initiated at the first visit and done periodically as needed. And then, of course, documentation is a priority. Wound care trends include interdisciplinary teams and networks, care conferencing, telehealth, telewound with photography and a wound electronic medical record, and also an increased use and increased need for nurses with these specialty skill sets. There are three categories of maternal child home care. They are high-risk pregnant women, high-risk infants, and children. The role of the nurse depends on the client's condition. The role includes assessment, health education, skilled nursing care, as well as delegated medical functions. Trends in maternal child home care include more home care now to improve pregnancy outcomes, the use of telemedicine, the use of the case manager model of care, as well as research and evaluation. When assessing pain in the home, refer to the assessment tool 13-1 on page 378. Often, pain is underestimated and inadequately treated. The nurse's role in pain management is to establish a relationship and trust with the client and family, performing a comprehensive pain assessment, focusing on prevention and early intervention, decreasing and eliminating barriers to effective management, performing delegated medication functions, and also health education, consultation, as well as case finding, referral, counseling, and advocacy, and also the use of alternative methods of pain management. Trends in pain management include an increased use of complementary therapies such as relaxation or meditation. There's also an increased use of various technologies such as setting an alarm for pain medication administration or wireless electronics to control a pain pump. There's also an increase in research and evaluation of pain management strategies and interventions. There's research regarding new pain medications. Hospice care focuses on care to the terminally ill with 6 months or less to live. Agencies that provide hospice care are committed to maintaining supportive social, emotional, and spiritual service to the terminally ill as well as support for the client's family. Care varies based on the needs of the patient and family. Focus is always on the client and family as a unit. Hospice care is provided in the home, hospital, or a freestanding agency. The nurse's role in hospice care is to shift the focus of care to palliative care and strengthen the client's and family's quality of life as the client faces death. This would be death with dignity. This nurse must use therapeutic communication and respond to psychological needs. This nurse performs assessment and delegated medical functions. The nurse also performs pain management and comfort measures. This nurse should be culturally aware and sensitive. This nurse also provides bereavement counseling and support for families. With hospice care, following the death of the client, bereavement counseling and support for the family continue for a year. Trends include research into end of life issues with an emphasis on personal choice. Another trend is the increase in the recognition of the importance of pain management. The last trend is an increase in collaboration between palliative and hospice care. Trends in specialized home care. Healthcare reform and the reimbursement changes that are required are expected to increase demand for home health care. There will be an increased demand for community based chronic disease management programs, increased partnerships with hospitals and insurance companies. These are all trends in specialized home care. Specialized home care and hospice will be important settings for practice. The client advocate role is essential. Challenges are related to meeting changing regulations, documentation, and maintaining cost effectiveness. Certifications for nurses in areas of practice are and will be expected. Teaching and supporting clients and families occur as a result of increasing responsibility for caring at home. Technology use is vital and will continue to increase. We must balance high tech with high touch. Question number 1. Disease management is defined as an approach A. Focusing on health promotion and disease prevention activities in client care. B. To deliver health care to persons with chronic illnesses that aims to improve patient outcomes while containing health care costs. C. That assists the client and family to a peace and dignified death through end of life care. Or D. All of the above. The answer is B. To deliver health care to persons with chronic illnesses that aims to improve patient outcomes while containing health care costs. The rationale. Disease management programs encompass providers across the healthcare continuum, including home care. Disease management is based on the premise that coordinated, evidence based interventions can be applied to clients with conditions that are high cost and high volume. The goal is to improve clinical outcomes and lower overall costs. Question number 2. Which of the following is a trend in pain management in home care? A. The increasing use of complementary therapies. B. Hospitalization for pain management. C. Focus on approaches to the management of chronic upper back pain. D. Focus on decreasing the use of pain medications that take advantage of the body's natural ability to block pain processing. The answer is A. The increasing use of complementary therapies. The rationale is that trends include increased use of complementary approaches to the management of pain. For example, standard care versus chiropractic, acupuncture, or massage therapy. Question number 3. In order for a client to qualify for hospice care, he or she must have A. Medicare to cover initial costs, B. 6 months or less to live, C. An agreement to stay at home for the duration of his or her illness, or D. Infusion therapy at home no more than 3 times a week. The answer is B. 6 months or less to live. The rationale is that clients are admitted to hospice when their medical diagnoses determine they have 6 months or less to live. The focus is on the delivery of end of life care, which promotes quality of life.